I'm at the mercy here of the I think. Oh, okay, great. So what we then developed a preclinical model in rodents of cannabinoid exposure. This is a model that the neuroscientists have been using for 5-10 years. So it wasn't a new model. Thankfully, the neuroscientists weren't looking at metabolic outcomes. But in this particular model, you can see here, we have Wistar rats that are given either 3 milligrams per kilogram THC from gestational day 6 to term, which is 22 days in the rat, or 3 milligrams per kilogram CBD or vehicle. Now, they're given the cannabinoids IP from gestational day 6 to term. We can't go earlier than gestational day 6 because this adversely impacts implantation in the rat. But we can give pretty much that cannabinoid from gestational day 6 all the way to term. And then we let the animals go, we let them deliver, and we follow up these animals in postnatal life and look at metabolic outputs, indices, heart function, glucose tolerance, et cetera, et cetera. So the first I want to talk about is THC. We chose this dose of THC, again, that's been used in the literature before, because we feel it's a low dose. We're not trying to prove that a high dose of THC leads to fetal demise. We're trying to mimic the patient that might turn to THC on a daily basis to relieve anxiety, for example. This dose leads to around 13 to 16 nanograms per mil in circulation in the rat. And this is at the lower end of what's been reported in cannabis users who use a 7% content THC cigarette from half an hour to 22 hours. So it's a low chronic dose of THC. The same thing goes with CBD. Less is known about using CBD in animal models, but we matched it. We did 3 milligrams per kilogram CBD. We also used 30. We'll talk about that later, because we find that leads to about 10 nanograms in circulation, which is at the lower end of what CBD is reported in human umbilical cord samples, a variety of patients. The take-home message here is we're using a low dose chronically to see what is the impact on maternal fetal outcomes, and more importantly, postnatal outcomes. So the next slide just shows you, we did some HPLC, that indeed, when we give these cannabinoids during gestation, this crosses the placenta and gets into neonatal circulation. This is just HPLC of measuring THC and CBD in the PND1, the postnatal day 1 liver of the neonates that are born from these pregnancies. You can nicely see that obviously THC injections leads to around 400 nanograms per gram of THC in the liver, so it's a nice transfer to neonatal circulation. And same with CBD, we get CBD crossing from the placenta and getting into neonatal circulation in the liver as well. So the first objective is we see that these cannabinoids are crossing the placenta, and they seem to be impacting fetal circulation, neonatal circulation, and the question is, do they impact fetal development? And that's the next slide here. Oh, before I show you that, this is just to show you, very importantly, when you do a preclinical study, is to pay attention to mom. And you can see here that this low dose of THC during pregnancy does not impact gestational length of pregnancy, does not lead to preterm labor, does not impact maternal food intake early in pregnancy or late in pregnancy, does not therefore impact pregnancy weight gain, and overall does not impact litter size. So we are very pleased to see that this dose of THC is not toxic and is not having major stressful events to the mom or impacting maternal physiology. It leads to 100% live birth index, survival to PND4. And what you can observe, though, is there's a modest but significant decrease overall in fetal weight, and about an 8% decrease in fetal weight, very consistent in both male and female offspring. And the next slide will show you that more of it. Oh, it didn't turn out as well. But the next slide shows you then the impact on the specific organs as a ratio of total body weight. So the top left is a decrease in the fetal to placental weight ratio. We did a cohort with Dave and Natalie in the audience. We looked at whether or not there's an impact of this on the placenta. And I don't have time to talk about all the placental outcomes. Sandy will talk about this later today. But we see here a decrease in the fetal to placental weight ratio, a hallmark of placental insufficiency. We see that 8% decrease in body weight, the top middle slide there. On the right, we see a 25% decrease in the liver to body weight ratio, which is pretty remarkable, a 20% decrease in the brain to body weight ratio, a 25% decrease in the heart-to-body weight ratio, and a smaller pancreas. So collectively, this tells us this leads to what we call symmetrical fetal growth restriction. All the organs were restricted about 20%, but these animals are now coming into the world with less liver, less heart, less brain. And what is the impact of this now as they get older? And remember that our gestational model stops with birth. So we have when the animals are born, they are no longer impacted by cannabinoids. And so the question for us is, what happens metabolically to these animals in postnatal life? That's my slide, very good. So the first thing we looked at, I can't show you all the metabolic outcomes today, but we did glucose tolerance tests on the animals. We know the pancreas has cannabinoid receptors 2 and 1. And so we saw here, we did glucose tolerance tests on our 6-month THC-exposed offspring. So we fast the animals overnight, give them a bolus of glucose, and look to see how their ability to regulate glucose over a 2-hour period. And what you can observe, quite strikingly, is that the female THC-exposed offspring have impaired glucose tolerance, but the male THC-exposed offspring do not. In fact, the female THC-exposed offspring have impaired glucose tolerance despite the fact that they're actually making more insulin in response to the glucose challenge. So they're hyperinsulinic, but yet this is not enough to make them glucose tolerant. So we've seen a female-specific effect already in these animals, which was very interesting to us. Knowing that this was an issue here, potentially with the insulin receptor, we focused on an insulin receptor target organ, such as the muscle. What we did with the cohort of our female THC-exposed offspring is we gave them, we took a cohort and gave them plus-minus insulin injections basically in the hepatic portal vein. We wait 5 minutes, plus and minus insulin challenge, and we take a snippet of their muscle before and after insulin, and we look at a target insulin receptor target in the muscle, in this case, phospho-AKT serine 473. So I'll take you through the slide here. What you can see here in our vehicle animals, we see here in the white bar, the saline, that after we give insulin, we see a nice upregulation of phospho-AKT in our vehicle-exposed offspring, which we should see in response to insulin. But in our female THC-exposed offspring, there is a blunted phospho-AKT response that is occurring. So they have an impaired insulin receptor function in the THC-exposed female muscle. So this is part of the reason for the glucose intolerance observed. But of course, we went back to the pancreas, which is going to be our source of those insulin-producing pancreatic beta cells. If I can get that. And we see a really interesting story that emerged. We see if we do histological sections of the pancreas and we assess for beta cell mass, we see that at 3 weeks of age, shown here on the right, that the 3-week THC-exposed female has reduced beta cell mass as early as 3 weeks, and then at 6 months, this persists, so that there's continued decrease in beta cell mass, specifically in the female pancreas, THC-exposed pancreas, but the male exposed pancreas has no change in beta cell mass. So now here we have a pancreatic defect in beta cells that is female-specific, occurring as early as 3 weeks of age, and persisting to 6 months of age. Moving along, we did, again, I can't show you all the metabolic data. I want to focus on the heart, but we do see that these animals have an increased adipose to body weight ratio. We collected visceral adipose tissue. I wouldn't say these animals are obese by any means, but they have an increase in adiposity at 6 months of age, both male and females. But if you look at the livers and look at triglycerides, we see now a male-specific elevation in hepatic triglycerides, which we went on to publish, which is due to the fact that there's higher synthesizing enzymes involved with making triglycerides. So now we have demonstrating that we have a dysglycemia and dyslipidemia in these animals, which is very sex-specific. And to date, this data is really interesting because I just came back from Colorado, and Colorado was the first state in the United States to legalize cannabis, and they have some nice studies. And of course, one of the studies that's emerged from Colorado is called the Healthy Start Study. And what it did is it looked at a cohort of mom-child pairs for moms that use cannabis in pregnancy. They measured cannabinoids to confirm the cannabis use. And they adjusted, though, very importantly, adjusted for socioeconomic status, ethnicity, tobacco use, and breastfeeding. And what they found, and it's a small study, but what they found, you can see here highlighted, is that 5-year-old children that were born from moms who use cannabis, when we adjusted for these factors, do have higher fasted glucose and higher insulin levels. So there appears to be dysglycemia from this study, and I like to joke either they modeled us or we modeled them, but it's nice to see a human study now kind of verifying some of the outcomes from our animal study. And the same study also looked at adiposity and found when they controlled for socioeconomic status, ethnicity, tobacco use, etc., that 5-year-old children from moms who use cannabis had increases in fat mass, fat-free mass, and increased adiposity. Again, only 5 years of age, and our animals are older, but it's interesting to see some parallels here between our preclinical study and what's coming out of Colorado with the human data. But I think some of the most interesting data comes from the work of my PhD student, Kendrick Lee, who's in the audience, looking at heart function. We were very fortunate to be able to do echocardiography on these offspring. And so at PND1, we did echocardiography on the THC-exposed males in this case. We only did the males early on. We didn't have the funds to do everybody. And what you can see here is that these animals, and as you know, they have a smaller heart. They had higher heart rate at birth, but they did have a decrease in stroke volume and a trending decrease for cardiac output. So this is right at birth. You could argue this is due to direct effects of THC, but we wanted to know what happens to these animals 3 weeks later, after THC is long gone, and after the animals have undergone catch-up growth. They'll be born with low heart rate, but those hearts will catch up in growth by 3 weeks of age. So 3 weeks later, Kendrick did echocardiography on these animals, and he still found sustained decrease in stroke volume and now a decrease in cardiac output. And one of the thoughts here as to why there's a decrease in cardiac output is Kendrick was able to measure the the thickness of the atrium and the ventricle, and he found an increase in the left ventricular anterior wall. So we found a thicker cardiac wall. And this has been observed in other models of fetal growth restriction, where you have, for example, nicotine, hypoxia. When the heart catches up in growth 3 weeks later, there's what we call cardiac remodeling, and that's not a good thing. So the heart recovers, but in doing so, it has disproportionate thickness in its vessel walls. So we have a thicker left ventricular anterior wall, which we think is one of the reasons for the impeded cardiac output. But Kendrick went on to look at markers of cardiac remodeling, shown here in the next slide. There you go. And what he found is what others have found in these fetal growth restriction models with nicotine, et cetera, was he found an increase in collagen 1, an increase in collagen 3, a decrease in MMP2, metalloproteinase, and an increase in GSK3 beta. The increase in GSK3 beta is also a marker of early fibrosis in these 3-week hearts. And the final thing he did here is he looked at CHOP. Now, CHOP is a downstream marker of chronic ER stress, endoplasmic reticulum stress. And when CHOP is increased, it suggests early apoptosis. So as the heart remodels, it's undergoing major apoptosis. So this is some of the mechanisms that Kendrick showed that would suggest that these THC-exposed hearts are undergoing cardiac remodeling at 3 weeks of age. But again, we're just so surprised that we saw these cardiac deficits so early in life in these animals. And so now I'm going to switch to the prenatal cannabidiol CBD exposure. That's a big question. As I said to you earlier, CBD is thought to be so safe. In some cases, we see it being promoted for a healthy lifestyle and use it in pregnancy to make a better baby. And so we wanted to ask the question, what happens if we expose pregnant rat dams to CBD alone? And we did so in a similar manner as we did THC. We did 2 doses, 3 milligrams per kilogram per day and 30 milligrams per kilogram per day. We want to cover 2 different doses. We know that cannabidiol has less affinity for its receptor as THC, but we also know that as humans, we can tolerate lots of of CBD. It's a much safer cannabinoid than THC. It's less toxic. So we tried the 2 doses and want to see what happens first to maternal fetal outcomes and secondly to postnatal heart function. And then one of the things you'll see Kendrick did after he did the echocardiography on these offspring, he also did some RNA sequencing as well. So let me show you what the first and foremost what happens to, just move along here. Yeah, so what happens to maternal outcomes? Well, just like THC, both doses of CBD does not impact gestational length of pregnancy, does not impact maternal food intake early or late in pregnancy, does not impact maternal weight gain, litter size at birth, or survival to PND4 and onward. But unlike THC, cannabidiol exposure does not lead to a decrease in fetal growth, decrease in birth weight at either 3 or 30 milligrams per kilogram CBD. So we have no major effect on, shall we say, fetal growth restriction. Now what Kendrick noticed, oops, it's already gone. Oh, now it's going, I got it, we're good. Gotta go back. What Kendrick did notice, it was trendy but not significant. He started to notice a slight decrease in the heart to body weight ratio, which made us still want to look at heart function at 3 weeks of age. So it appears at this point that CBD might be safe. It's not impacting fetal development. But what came as a surprise to us was when we looked at echocardiography at 3 weeks of age, and it's coming, I hope, there it is. We found a striking decrease in cardiac function exclusively in the male offspring. So this study, unlike the THC study, we were able to do both in male and females at 3 weeks of age. And Kendrick saw that both doses of CBD impacts negatively stroke volume, cardiac output, and the higher dose of CBD actually impacts ejection fraction as well in these male-exposed CBD rats at 3 weeks of age. So we're seeing a similar outcome as we saw with THC. It's male-specific, and we were just quite surprised by this because we didn't see effect on at birth of heart or overall, but we see this sustained effect at 3 weeks of age. And one of the issues with CBD is just so little is known in the literature about what are the targets of how CBD could be working, aside from the endocannabinoid system itself, but what are the downstream targets that CBD could be impacting to influence cardiac development. And the slides jumped on me, which is great. So Kendrick did bulk RNA sequencing of the heart ventricle, and you can see here a wide variety of KEGG pathways that are identified from this RNA sequencing. And many of the pathways do make sense. For example, shown here with the red arrows, with the low dose of CBD, we see changes in TGF-beta signaling, which we know is very important for cardiac development and function. We see changes in the FOXO signaling pathway, which is also important for cardiac function. With the higher dose of CBD, both of those pathways are also represented. We also see effects on cardiac muscle contraction, KEGG terms identified cardiac muscle contraction, and KEGG terms identified with insulin signaling, which we also know impacts cardiac function as well. I think of great interest, though, is the very bottom one here, which is one of the most significant pathways that was altered, as demonstrated by KEGG, and that is the endocannabinoid system itself. Oops. I'm just going to go back to illustrate. Sorry. My pointer's having fun with me today here. That's okay. So the endocannabinoid system itself is impacted by prenatal CBD exposure. How fascinating is that? And so we pursued this further. Kendrick then looked to see if aspects of the endocannabinoid system could be altered in the CBD-exposed heart at 3 weeks of age. And why this is also important, I'm just going to, now we're fighting here. Here we go. Come on, you can do it. There we go. So there has been some exciting studies showing that a dysregulated endocannabinoid system is associated with cardiovascular pathologies. That's been demonstrated already. Cannabinoid receptor 2 in particular has been demonstrated to play a cardioprotective role. It's thought to be anti-inflammatory, reduce apoptosis, and cardiac remodeling. And CBD has been demonstrated to impact the endocannabinoid system in the heart as well, as it can modulate cannabinoid receptor 1 and inhibit FAAH. So we have no idea. We were curious to know then, okay, if the KEGG pathway is saying the endocannabinoid system is affected, what happens to the receptors of the endocannabinoid system in our 3-week hearts? And so then Kendrick did some real-time PCR to look at the messenger RNA levels of the parts of the endocannabinoid system. And hopefully that comes up next here. It should. There we go. And what he found, he looked at cannabinoid receptor 1 and 2. He looked at the enzymes that are synthesizing cannabinoids and the enzymes that are degrading cannabinoids. And the take-home point here is what he found was a decrease in cannabinoid receptor 2, specifically in the male CBD-exposed heart. He looked at this in the female. We're not showing the female data, it's just too much to show. But in the males, he sees a decrease in cannabinoid receptor 2 in the heart. And this is really exciting because we know CB2 is cardioprotective. It produces inflammation. And Kendrick went on to confirm that by looking at the protein levels of cannabinoid receptor 2. And it will come up. Look at that. And he sees a nice decrease, especially with CBD 30 exposed offspring, a nice decrease in cannabinoid receptor 2. So again, what I find so fascinating about this is how ironic that exposure to phytocannabinoids in gestation is impacting our endocannabinoid system in postnatal life. And it's something that we should look at in several organ systems that might be influenced by prenatal cannabinoids. And so now I'm just going to switch and talk about, can we intervene? And of course, this is a very important topic. Can we intervene for those children who without choice were exposed to cannabinoids in utero? There's lots of different thoughts out there as to what would be the best way to intervene. And we really turn to omega-3 fatty acids. We know that omega-3 fatty acids have been beneficial for cardiovascular health. They activate our PPARs in both, if it's in the heart, but if it's in pregnancy, in the placenta as well. Increases in PPAR alpha have been shown to be beneficial to offspring that are from gestational diabetes, so that's interesting. It's been shown to reduce fetal growth restriction, and so omega-3 diet can reduce fetal growth restriction in models of fetal growth restriction. And so we then did what's called matrix-assisted laser deabsorption ionization, or MALDI, to visualize one of the major omega-3 fatty acids, DHA, in our 3-week male THC-exposed livers. So this is just a very quick data showing you that indeed there is about a 45% decrease in DHA in the 3-week male exposed THC livers. Remember, these are the animals that have cardiac dysfunction. There's also a decrease in stearic acid and arachidonic acid. And knowing this, then, as proof of principle, we then ask the question, what happens if we supplement mom during pregnancy with an omega-3 fatty acid diet? So that's what this diet is. So in this particular protocol, we once again give our animals either vehicle or THC throughout gestation, but we also have a cohort of animals where we supplement them with an omega-3 fatty acid diet, lots of DHA, it's almost an overkill of DHA, and then we followed up these animals and asked 2 questions: what happens to maternal fetal outcomes, and what happens to cardiac function later in life in these omega-3 animals? Now, I know what you're all thinking. Why would you supplement these animals during gestation? Shouldn't you try to do this in postnatal life? And that is a long-term objective. We want to start off and just see how the perinatal window of omega-3 supplementation may do to reduce fetal growth restriction and cardiac dysfunction in these animals. So let me show you the data from there. Once again, we went through all of the important maternal outcomes. The omega-3 diet does not impact maternal food intake, gestational length, weight gain, litter size at birth. And of course, neither does THC, so that was good to pay attention to. And what's exciting here, shown here on the left, that supplementation with the omega-3 fatty acid diet does ameliorate the fetal growth restriction on the left. It doesn't look that impressive, though there's an 8% decrease in the birth weight, as I've said before, and the omega-3 diet has ameliorated that. But more impressively is the right graph, which we look at the heart-to-body weight ratio at birth. We once again see that THC decreases the heart-to-body weight ratio in our normal animals on the regular diet, but that supplementation with the maternal omega-3 diet ameliorates that decrease in the heart-to-body weight ratio. So we were thinking, okay, this is looking good. What about at 3 weeks of age? What about heart function? And before then, we looked at heart function. We did want to pay attention to our DHA concentrations. On the left is our MALDI imaging, which allows us to look at DHA in the liver. And you can't, it's very semi-quantitative. You can't really appreciate it, but there's a decrease in DHA in the THC-exposed liver, as I showed before. But you can see here when you give the omega-3 diet, we just overkill those livers with lots of DHA. But I think most importantly is the graph on the right, where we did LCMS to look at DHA in the heart. We see now in the heart at 3 weeks of age, this is when we have cardiac dysfunction, prenatal THC has depleted DHA in the heart. But then when we give the omega-3 diet, we have overcome this depletion of DHA. And so now the question is, what happens to heart function? And that's where then Kendrick did echocardiography. And that's the next slide. Here we go. And you can see here that once again, THC-exposed offspring on a regular diet had a decrease in stroke volume, a decrease in cardiac output. But when we supplement those moms with an omega-3 diet, we ameliorate that decrease in stroke volume and we ameliorate that decrease in cardiac output. So very promising effects here of using perinatal omega-3 supplementation. The goal now will be to refine this intervention and ask the question, does postnatal intervention alone or the period of lactation, would that period of supplementation alone be enough to rescue the hearts of these THC-exposed animals? The goal here, of course, is to rescue children who without choice were exposed to cannabinoids in utero. Another important question mechanistically then is the omega-3 diet rescuing the placenta, which has PPARs expressed in the placenta? Is it rescuing the heart or is it rescuing both? And I would put my money that it's affecting both the placenta and the heart. And that's studies that we're now doing with Dave Natali's lab, looking at the promising effects of omega-3 to improve placental function. And I just want to talk about, finish off by saying this isn't all about mom. This isn't all about maternal exposure to cannabinoids. We also have to consider preconceptual exposure to cannabinoids, and just as important, paternal exposure to cannabinoids. I just want to show you once, this is not our work, but this is a publication which showed that if you gave a cannabinoid receptor 2 agonist, JWH133, if you give it to it's mice in this particular case for 5 weeks, daily injections for 5 weeks, is a lot of injections, and then you allow these mice to breed. They actually have impaired sperm function, but they are able to breed. You see here that the cannabinoid receptor 2 agonist exposed offspring have a smaller placenta, which maybe we can talk about later, but most importantly, they have a decreased birth weight. And so the question will be is what happens to these offspring later in life with respect to heart function, glucose tolerance, and lipids? And we would like to ask this not with the receptor 2 agonist, but really ask the more direct question, what does paternal exposure to CBD or CBD do to metabolic outcomes? And, oops, sorry about that. So anyway, we've been very busy the last couple of years, and you can see here we've seen a variety of effects of THC, gestational THC exposure in the placenta, in the liver, in the fat. I didn't talk about too much of that today. The heart, the pancreas, the brain. That's my colleagues are here, Dr. Steve Laviolette's lab, looking at neurodevelopmental outcomes. We looked at insulin resistance in the muscle. And some nice work with Alison Holloway and Jim Petrick here at McMaster in Guelph. We've actually seen long-term impacts on the ovarian function of our THC-exposed offspring as well. So there's more to the impacts of cannabinoids than just the brain. We see it in a wide variety of metabolic organs which express these important cannabinoid receptors. And with that, I am done. Thank you so much for your time, for this invitation. Oh, I'm right on time. I'm very happy. Thank you very much. And I'm glad to take any questions you may have. Thank you. Very good. Should I just look for hands?
If you have any questions, you can use the microphone.
Oh, sure. Oh, right. Yeah.
That way, people on Zoom can hear your questions.
My lab's not allowed to ask me questions. Just kidding. Anybody? Oh, there's Sandy. Sandy's got a mic, and then...
Somebody else have a question?
Yep. Go ahead, Sandy, then we can...
Okay. So Dan, really nice work. I was just wondering, with all the changes in the cardiac parameters, did you see changes in blood pressure?
No. So that's the challenge. So we didn't do blood pressure. First of all, these are 3-week animals. We did not do blood pressure. I wasn't expecting to be changes so early, and it's one of the goals is to look at these animals as they get older. One of the challenge, I admit, though, is that in the these rats get huge. So as these animals age, they get to 3 months, they're just so big for echocardiography. There's different sized probes and stuff, but you get issues with the chest wall. It's very challenging to follow these animals that they get, unfortunately, because they're rats, they're so big. But that's one of the long-term goals is as these animals get larger to look at blood pressure. We were just so surprised to see it so early in life, and that's kind of a scary thought. So, yeah. But great question, Sandy. Hi.
My name is Arina Trofimova. I'm a psychologist. Any insights that you have into sex differences and interaction with gonadal hormones, perhaps, for cannabinoid?
Great question. And again, I was limited to what slides I could show. So we were interested to see what's behind the female-specific changes in pancreatic beta cell mass. And so we actually so there's a big story with estrogen receptor, and beta cell apoptosis. So we measured estrogen, progesterone, and testosterone in our offspring at 3 months or 6 months. No change in circulating sex hormones. So the hormones are the same, the sex hormones. However, there's more to endocrinology than the hormones. We looked at the receptor and found that in our THC-exposed female pancreas, there was a decrease in estrogen receptor alpha, and that did not occur in the male THC-exposed pancreas. So there appears to be changes in receptor expression due to cannabinoid exposure, if that answers your question. But thank you. Yep. Some slides I had to cut out, so that's great. Hi.
Hi.
How are you?
Allison
Very well.
Shea.
Good
Nice
to see you. Yes.
Thank you. Excellent talk. Really exciting to hear about the omega supplementation. So just a couple questions.
Sure.
I don't know if you said, did you do it throughout the whole pregnancy as well as lactation?
Yes. Sorry, I said perinatal. So
Okay.
I meant, and that's so pregnancy and lactation.
Okay.
And so that some may argue, well, it's too big a window, right? But we had to start somewhere. And so we did pregnancy and lactation. And as I said at the end of the talk, I'd like to now focus in on just postnatal lactation only to see if we can rescue these
Sure, I was
animals.
just going to say if there's a rescue mechanism, that would
Yeah.
be great.
Yeah.
And I guess how did you choose the amount of the diet, like the dose of the omega-3, and how would you suggest that play into clinical practice?
Okay, well, that's a great question, and I'm at fault because we actually lined up with my colleagues, the neuroscientists. They picked the diet, and it seems to me a bit high, a bit overkill. So it's not necessarily. I'm getting back to the clinical question. I'm not sure if it's more than we would give or prescribe for our mothers. But that's a question we have to go back and refine and perhaps dose better. I think I would just focus on DHA and dose better what concentration of DHA is enough to rescue not only the fetal growth restriction, but the cardiac deficits as well. But you asked a really good question. Thank you. Any other burning questions? No? Okay, thank you so much. Thanks again, guys.